Hey helpers, you asked, how do I help my clients get better sleep? And I love this question because sleep is one of the most salient issues when it comes to therapy, and sleep is oftentimes a really crucial indicator of what's going on in the client's world, and it tells us a lot of information and gives us a point of intervention and leverage and how we can help them. So I think of sleep as a vital sign, just like when you go to the primary doctor and they take your blood pressure, your temperature, etc. When we're doing therapy, most of the time, every session, I'll ask, hey, how are you sleeping? Right? I ask this question a lot because it is like a vital sign and it's going to give me a lot of information. And one thing we know about mental health in clients is that sleep can have different patterns depending on what's going on with a client. For example, if a client struggles with major depressive disorder, then they may have good sleep for a lot of the time, but when they're going through a depressive episode, they will oftentimes have hypersomnia, or where they're just sleeping a lot, way more than usual. Same would be true if somebody has like a bipolar disorder. They might sleep okay for a lot of the time, but when they're ramping up to a manic episode, for example, then they won't be sleeping maybe for 2 or 3 days. And they'll have a lot of racing thoughts and other things that go hand in hand with that. And so sometimes there's not anything as extreme as one of those two examples, but not sleeping well can be a number of things, such as chronic nightmares, recurrent nightmares, intrusive thoughts, just due to high anxiety, and can tell us a lot about what's going on within the client's world. So, great question, and I'm so glad we're talking about this. One thing to note is that sleep is oftentimes something we really want to assess for on the front end during the intake assessment, and we don't want to drive by the sleep topic too quickly because there's a lot of really good meaty information there that we want to kind of dive into. Okay, so when we're talking about sleep, we think about insomnia or sleep anxiety, right? Which can sometimes be two different things. Insomnia could be a number of things. Just to be clear, however, I am not a doctor. I'm a therapist. And so if you are having sleep issues or your client's having sleep issues, of course, always have them make sure they've had their physical and they're following up with their primary care to make sure it's not anything due to a primary medical or general medical condition, right? That's mental health 101. We never want to label something as a mental health issue before we roll out general medical stuff, okay? There you go. I'm not a doctor. All right, so when we think about night anxiety and what we can do about it, right? The first thing to understand is that nighttime anxiety and insomnia are common and very distressing for clients, right? As we know, whether you have mental health challenges or not, if you don't get a good night's sleep, it affects the rest of your day, right? And what we know is that we generally want to get at least 6 hours of solid consecutive sleep in order to function, mostly well, maybe closer to 7 to 8, depending on the age group you're working with. Teenagers need a little bit more, give or take. So bottom line, we just need a good solid sleep, especially when we're talking about how the body builds things like the human growth hormone, which is a primary factor in creating serotonin. It's a precursor, just like tryptophan and niacin. But the human growth hormone comes from good sleep. That's when the body does its repair, and we can't get deep sleep unless we're getting solid 4 to 6 consecutive hours. So very important, especially for our mental health. And it's one of the biggest risk factors for declining mental health if we do not get a grasp of it, right? So we know that it impacts daily life, mental well-being, and understanding why we're having sleep issues, our clients are having sleep issues, will give us effective points of intervention, be that sleep hygiene, be that diet, be that lifestyle, etc., be that addressing the cognitive intrusive worries through a CBT lens versus a solution-focused lens. We're really trying to kind of figure out how we can get at this, because sleep is not a one-size-fits-all issue. It's definitely something that has a lot of dimension to it, right? But what we do know is that improving sleep is possible, right? So we've all heard of the circadian rhythm. The circadian rhythm is just the pattern of sleep your body gets used to, which is why if a client's doing a lot of day napping because they don't sleep at night and then they take a 2 hour nap during the day, it's really going to be hard to get back on track. And from my experience, it takes about 2 to 3 weeks to reset your circadian rhythm on staying to a regular sleep schedule. And correct me if I'm wrong, if you know more about sleep than I do, which could very well be the case. Maybe it takes longer, maybe it takes less. Let me know in the comments. Share with the group. What we know is that cortisol spikes in the evening. That's your stress response hormone, right? Chemical. And that melatonin drops as cortisol increases, right? We actually want the opposite. We really want our melatonin to be increasing, right? Because that helps us get more sleepy, relaxed. But if our cortisol levels are outweighing our melatonin, it's really going to contribute to a lot of those sleep issues, right? Brain activity increases at night oftentimes. And we talk a lot about this with clients in the sense that if they don't have quiet time during the day to really reflect on what's bothering them, what's on their mind, what, things they want to accomplish, then what ends up happening is your brain tries to get busy problem solving as soon as your head hits the pillow, because that's the only quiet time it has to really address these issues, right? And so this is kind of a perfect storm for anxiety to worsen at night between our hormones and the busyness of life in our mind. So we really want to kind of look at all of these factors and try and figure out how can we help clients get a hold of this, right? And there are the exceptions, right? There are some non-24 people out there. They think it's approximately 8% of the population don't have a 24-hour clock. So they might be on a 36-hour clock, for example. And so that their sleep cycles may look a little bit different. These types of people tend to sometimes do better on graveyard or swing shifts with work, and they figure it out. But it is very much a individualized thing, and we're just trying to figure out what works best for clients and how we can help them build their lifestyles around what works for them. Okay. So the role of our minds in cognitive and emotional triggers, right? So we know there's definitely a lot of daytime stressors, stuff going on with families, stuff with work, other concerns that oftentimes get put on the back burner in our minds because we don't have time to deal with it. And sometimes it feels like life is just coming at you, right? And if we can't deal with things one at a time, stuff starts stacking up. Then that can become very overwhelming and really come out during those quiet hours of the night. And again, we talked about that. The ruminating, your brain starts to try and problem solve, but it's really not the best time to work on those issues, right? That's when we're supposed to be resting. So our thoughts tend to get louder at night, and that's a problem, right? So in therapy, we really encourage something like a worry journal. And a worry journal is a tool we'll talk about in just a minute that I've found very helpful when it comes to intrusive thoughts that are more anxiety based and maybe not so much of a chemical imbalance issue like you would see with a bipolar disorder or major depressive disorder. Sometimes general anxiety disorder can have a different flavor to it. It's more the intrusive thoughts of worry, the random thoughts at night that kind of keep people up, right? So other than those general things, right, be it a thought process condition, anxiety, or chemical imbalance, there are definitely some environmental factors that come into play. Caffeine and alcohol consumption in the evening can definitely impact our quality of sleep. Excessive screen time, scrolling on TikTok, Instagram, that kind of stuff. That blue light, you've heard about blue light, it messes with our dopamine receptors. So we want to be careful that we're limiting the amount of blue light before bed. They say usually no screen time, an hour or two before bed if possible. If you have to use your phone, there's a setting I believe you can turn off the blue light. So that can help, right? We want to make sure that we have a regular and comfortable sleep environment. We'll talk more about that, but that could look like cool temperatures, 69 degrees, making sure the room's dark. You don't have a lot of light exposure too early, right? You want to keep it nice and sleep friendly. uncomfortable sleep environment, the importance of a well-lit room in the morning. So we do want sunlight to wake us up in the morning, but we don't want sunlight before we're ready to wake up. So, if you need blackout curtains, those are something you could use as well. But we're really trying to help our body wake up naturally when possible. And all of these little things can tend to stack up over time, right? We'll talk more about that. So sleep hygiene. So that looked like a consistent bedtime routine and environment. So now we're talking solutions. So how can we help our clients come up with solutions to address their sleep challenges? And that goes back to figuring out and spending the time to identify what kind of sleep problem this is. Is this a quality of life issue? Is this a sleep hygiene issue? Is this a stress management issue? Or is this a chemical imbalance issue? And so all of those things we have to take into consideration, but there are relaxation techniques we can help clients adopt, such as deep breathing, grounding exercises, as well as that worry journal I just mentioned. And worry journals really help externalize your thoughts before bed. And I've put out some other videos about worry journals. I have one I've created. If you want to check it out, I'll share that with you in a minute. But really that's helping to externalize one's worries on paper, and so you can put it away and come back to that at a later time. That really helps give the brain some closure that you're not going to forget to address the problem, which is oftentimes what fuels anxious thoughts, is the fear that if you don't think about it or solve it right now, then somehow it's going to fall by the wayside and everything's going to fall apart. Right? That's how the brain works. It doesn't like anything that feels threatening. So a worry journal helps us kind of put that in a box. We'll come back to it. We can confirm it to ourselves, to our brain, our subconscious. Hey, we're coming back to this thing and it's going to be addressed. Okay. Sleep restriction is important. Sleep restriction means limiting our bed for bedtime, right? Not hanging out in our bed during the day. I know some people have to rent rooms and they pretty much live in their bedroom, but as much as possible, we want to reserve our bedroom for bedtime and keep that to be a sacred space, right? Maybe you've heard of that before. And if you have any other ideas, of course, please let me know. Drop it in the comments. Share with the group. Okay, so beyond that, really, I just want you to think again about case-to-case basis. Like, try and figure out with your clients what the patterns and conditions are that are around the sleep that are causing problems. That's really going to help you inform your treatment plan and interventions around the sleep issue. Case example, like if a client presents with good sleep 70% of the time, but then doesn't sleep at all for 3 days at a time and has no need for sleep, they feel very energized and motivated, and they get a little grandiose and racing thoughts. That's a red flag for maybe a bipolar episode, right? If somebody's has good sleep most of the time, but then has chronic fatigue for a couple of weeks, that could be a huge red flag for depression. If somebody has just general poor sleep all the time, but nothing critical, then that could be more of a anxiety disorder, and you'd work more on the CBT side. So always think about case-to-case bases in terms of what might be going on. So in summary, nighttime anxiety and insomnia are very treatable. We just have to kind of figure out what's going on. It might even mean referring them to the doctor for a sleep study to make sure it's not something medical, generic like sleep apnea or something like that. We can take a holistic approach to the mind-body environment, and we can empower clients with tools and a sense of hope, right? We want to make sure that we do maintain that sense of hope that, hey, change is possible, improvement is possible. You're not the only person in the world to struggle with this. Let's use the information we have, what's worked for other people, what's worked for other therapists, to try and figure out how we can get a hold on this thing, right? And I'm very, very curious. Please do share what's worked for you or what's worked for your clients when it comes to sleep, anxiety, insomnia. Please share in the comments. The more we can inform each other, the more we can help our clients and serve better, right? Okay. So if you want to check out the handouts I have some sleep hygiene tips, handouts for your therapy practice, as well as a worry journal. And I'll kind of show what those look like here. So this is my handout on sleep hygiene, and it just kind of goes through a few basics for your clients. We don't want to overwhelm them with handouts, so I try and keep it, top level here. But some basic tips on what sleep hygiene is, some things to keep in mind. They could even tape this, by their bedside or keep it by their nightstand just as a reminder, or tape it on the mirror as they're getting ready for bed, just as a quick reminder. And what we focus on, we improve on, right? And this is very true with our routines, as we know. Trying to even regulate our sleep around a certain window can be very challenging. This is my worry journal handout. You can also grab this in the library. But the worry journal, again, you're trying to identify what the worries are verbatim. You write them down, and then you come back to it at a time when you can actually chew on it and come up with some plausible ideas and solutions. That's not actually bedtime, right? You want a time where you can focus and not interrupt your sleep. And ultimately, you're really trying to figure out, is this a tangible problem? Is this a vague concern? Is this a future problem, right? And so sometimes helping clients identify that too will help reduce those intrusive thoughts at night. So if you want to grab either of these handouts, you can just head over to the Mental Health Toolbox shop, and that will help you there. And I'll show you that right here. So you can just go over to mhtgear.com or the Mental Health Toolbox and just go to the shop, and you'll see I have all my handouts here. You can grab. I have lots of very affordable handouts as well as a lot of free ones. If you happen to be so inclined, you can get the All Access Pass for $10 a month, and then you can get unlimited access to all the handouts in the library for your therapy practice and your work with your clients. I do add to that weekly. I aim to add to it weekly. So if you want, you could sign up for a month, download everything, and then cancel it. I'm fine with that. But I do add to it daily. And you can always give your feedback if you like. I have a request button here at the top of your resource library. You can always submit me a personal request for a handout. If there's something you would like to see more of, just let me know. But this is what the library looks like once you get in there and set up your account. Okay, so hopefully you find that helpful. Like I said, you can go over to mhtgear.com to check those out. But mostly I'm interested in what's working for you. And if you could please let us know, and then we can all thrive together. Okay, so hopefully that was helpful. Sleep is a huge topic. If you'd like to see more videos and episodes around sleep, and what we can do to help clients with that as a therapist in our practice, please let me know, and I'll definitely make more videos like this. Until next time, keep social working. Take care now. Bye-bye.